Good evening, and welcome to tonight's telephone town hall. My name is Charles Parasino, and I will be moderating tonight with Congressman John Larson and our special guest, Heather Brauth. Thank you for joining our live interactive Access Live event. This evening, Representative John Larson will be taking your questions and discussing the ongoing government shutdown and President Trump's authoritarian power grabs. As I mentioned, this is an interactive forum, and we would love to hear from you. We will be taking as many questions from participants as we possibly can live tonight on this event. If you have a question, you can press *3 on your phone keypad at any time, and you will be placed in line to speak. The next time you hear your name, you will be live on the call, and you will be able to ask your question directly. If you are joining us online, you can submit your question in the form below the live stream. Representative Larson will do his best to answer as many questions as we possibly can this evening. If the Congressman is not able to address your question tonight, please call 860-278-8888 and leave a message along with your phone number or email address. Staff will listen to your voicemail and get back to you with an answer to your question. Again, if you have any questions throughout the event, please press *3 on your keypad. And to sign up for the Congressman's newsletter to receive updates and information about future events, press *6 on your keypad. Now I will turn it over to Congressman John Larson.
Well, thank you, Charles, and I want to thank everyone for joining us, and I'll be introducing our special guest in a few moments, but just wanted to go over some basics. Again, good evening, and we will continue to do what I think are practical and informative messaging to people. We've done town halls, and we go out to senior centers, et cetera, to explain what's going on currently in Washington, D.C., or the lack of what's going on in Washington, D.C., as well as to be able to answer people's questions. The most important thing in all of this is that we keep you informed, and especially because so many questions can come up, and hopefully we'll answer a lot of those in this evening's discussion, but always want to make you feel comfortable in calling our office at 860-278-8888. The reason I say and emphasize that is especially during these very difficult times when agencies themselves are under a lot of pressure, that sometimes it can be difficult with phone service and everything else to get through. And we ought to be working on your behalf to make sure, A, it might be an issue that we can answer and help with ourselves, but as importantly, it could be something where we can press the agency to get an answer and to get your concerns met as well. I'm especially proud this evening that we have with us Heather Brauth, who is just an extraordinary human being, first and foremost. I had the great honor and pleasure of listening to her speak on the steps of the Capitol just yesterday, where in a very straightforward manner, she laid out for the country what's at stake here in terms of health care and why are we going through this process? What is this shutdown all about? And where have the bright lines been drawn? And why is it that the Democrats are back and ready to work and sit down and come to some sort of conclusion? I won't even say compromise, but be willing to do this so that we can make sure that people are getting taken care of. Heather is a surgical nurse at Bacchus Hospital in Norwich and the leader of the AFT Local 5149 that represents the nurses there. When she spoke this week, she shared very powerful stories about her work as a nurse and advocate and for the already understaffed and strained healthcare system our country has. I want to again thank her personally for taking the time to join us both earlier this week and, of course, this evening so that my constituents get to hear from her directly. I think the stories and the experiences she has are incredibly powerful. So to hear from such an accomplished nurse like Heather, who works in the field day by day, I think will be both informative and also give you an idea about how this impacts not only the people who will lose, the 15 million Americans that will lose their health insurance, but also the ramifications that that has on the economy, on our already stressed healthcare systems, and how it not only affects the 15 million people directly, but our entire economy and how it will stress our healthcare system as well. That's what's at stake here. That's why we're fighting so hard. That's why we'll continue to fight and hold the line to make sure that we sit down at the table and come to a conclusion. Do not believe any of the nonsense that has been refuted over and over again by experts in the economy, by CNN, by National Public Radio, you name the source, that that immigrants are getting health care, and that's what we're fighting for in Washington, D.C. That is flat out false and does not happen. So, having said that, and now wanting you to hear from an expert in the field and someone I think who has great insight, let me turn the call over to Heather. When she finishes, I'll have a few comments, and then we'll go directly to the questions that you have and hope to get in as many as we can within the hour. And then, of course, any questions that are not answered, please communicate them to our office. We'll answer all the questions that are sent to us. That's my commitment and promise to you. And with that, Heather, welcome, and thank you so much for doing this.
Thank you so much for that warm and heartfelt introduction. I genuinely appreciate that. Good evening, everyone. My name is Heather Brous, as Congressman Larson said. I actually started off as a nurse in the ICU at Hartford Hospital up in your district 13 years ago when I first became a nurse, and then made my way down here to southeastern Connecticut, where here in Norwich at Bacchus Hospital, we serve patients from both rural and urban communities in the surrounding area. And as Congressman Larson mentioned, I am also proud to be the president of our local here, AFT Connecticut 5149. This partisan law has slashed Medicaid and allowed healthcare tax credits to expire for working families, all while funding tax breaks for billionaires, which in and of itself is just an outlandish thing to even try to understand. While that may be great for those who have money, it's going to make life so much harder and more expensive for everyone else, including more than 100,000 people here in Connecticut who will face higher premiums if the tax credits expire. I just read an article the other day that they're now actually anticipating it's going to be closer to 200,000. As healthcare workers, we take pride in giving our patients the very best care because that's what they deserve, but we've long been struggling with a healthcare system that's strained, broken, and battered. Already, our small community hospitals had one of the busiest years to date, and we're just getting ready to head into cold and flu season, which also is our respiratory virus season. So every other upper respiratory infection that you can think of that they're offering vaccinations for at CVS, we're going to see roll through the hospital in the next 4 to 5 months. And healthcare workers are getting scared. We anticipate it will be as bad, if not worse, than COVID in 2020. We've got patients that are sleeping on stretchers in our emergency rooms just about every night, and patients that are sleeping on stretchers in hallways up on our floors waiting to be admitted to beds, because we still need to be able to provide them care and stabilize these patients. We can't just discharge them back out when they're too sick to leave. So we have to make room, and the room just keeps getting smaller. Hospitals and clinics are going to close because of these cuts to essential services, forcing patients to travel further and wait longer for care. We're talking about 15 million people that are eventually going to potentially lose their healthcare coverage, and then millions more on top of that that are going to see their healthcare premiums skyrocket. Our communities are struggling to afford all of their normal daily living essentials, groceries, gas, rent, mortgage. I don't even begin to try to understand how the Republicans think that these significant rate increases to our community's health insurance is going to be sustainable. And we know that rural communities will face higher premium increases than other communities if the health care tax credits are allowed to expire. Nationally, a quarter of the farmers and ranchers in this country receive health care coverage through plans supported by those tax credits. We're going to see entire communities that are devastated if the politicians in charge of Congress and the White House don't do something and figure it out. They need to come back to the table and actually bargain a solution and make something that's sustainable and that can work for the American people. The frontline workers are scared, and everybody else out there who has a chronic health condition or a loved one with a chronic health condition, someone who's living in a VA facility, a skilled nursing facility, or going to a VA hospital, and anything and everything you can think of in between, should be very concerned right now. Because none of these cuts are going to stop people from needing emergency care, regardless of whether they live in a blue or a red community. Communities are going to suffer, people are going to get sicker, and it's not a stretch to say we're going to see people die because of this. It's already starting to happen. It's going to get worse. We've already watched patients put off their annual doctor's appointments, specialist appointments, surgeries, because they can't afford to follow through on them. These people then come into the hospital in a full medical crisis that could have been preventable had they been able to afford the preventative care that they should have had and frankly deserve. We hear from patients all the time. My doctor's office was bought out and now they don't take my insurance, or my doctor moved to a new practice. It's too far away. I can't find a new primary care provider close to me. People don't have transportation to get to these appointments that are already too far away. And with telehealth and the suicide hotline being slashed, we're decimating rural communities' ability to access affordable and appropriate preventative care. These are all real issues. These are all real struggles. We talk to our patients every day about them. The millionaires and the billionaires cannot even begin to fathom what their constituents are going through because they don't have a frame of reference that allows them to be empathetic to this situation. People aren't going to be able to afford their health insurance, period. They're going to stop paying their premiums because they're going to have to make a choice between insurance or their rent or mortgage or buying food. And they're going to choose food and a roof over their head and probably their automobile over their insurance. It's going to mean exponential and catastrophic increases to the number of patients that will be flooding our already overcrowded and understaffed emergency rooms across the state. And we already have a ton of patients that are underinsured or uninsured. So now we just have an influx of that, and the hospital absorbs it, and then it's a trickle down of how the funding gets back into the hospital. Our healthcare system has been sitting on a delicate, shifting set of plates for years. And these increases to the individual health premiums is going to be the shift that causes those plates to crack and cause a massive shock to people in the entire healthcare system that honestly is probably going to be studied for decades and maybe even centuries to come. These massive increases to health premiums will be the dismantling and dismemberment of our healthcare system as we know it. What can happen to people's health if they miss a doctor's appointment or miss a dose of an important daily medication? It's simple. They could die, period. There are so many people right now who, from a health perspective, are hanging on by a literal thread. One missed doctor's appointment could mean missing a change to a chemotherapy regimen that causes someone to fall into full-blown return of their cancer and spreading of it. One missed appointment with a cardiologist could mean a delay in changes to someone's blood pressure medication, and within minutes, hours, or days, they could have a stroke and end up with partial or full paralysis and an inability to speak or eat. One missed appointment with the neurologist could mean epilepsy going undiagnosed and that person driving down the road in their car, having a massive seizure, becoming unconscious and crashing into another vehicle. That other vehicle could be any of this. So why wouldn't we do everything that we can to prevent any of these things from ever happening if we have the option or the chance? Rural hospitals tend to have issues with resources. We sometimes have to wait to borrow equipment from other bigger hospitals within the system. We're also a hospital where people may come to be stabilized and then sent via LifeStar, the helicopter transport, to another higher level of care hospital. This may mean that people come to us in need of life-saving emergency surgery, but then need to be sent to another location once completed so that there are doctors and staff that can tend to their higher level post-operative needs. We here in Norwich see everything from stabbings, gunshot victims, farmers that have their machinery roll over on them, and then the every once in a great while heart attack over at one of the casinos. Our staff has to be masters at it all in order to provide the best possible care to a wide gamut of catastrophes, but we do not, and sometimes we do not get a second chance. Our hospital might be small in size, but it is huge in terms of the knowledge and the skill base that it needs to maintain. With an already 20% deficit in our nursing staff in our hospital, I have no idea how we're going to make it through this and come out on the other side. And I honestly beg and plead that anyone that has contact information for their Republican counterparts or a Republican senator or Republican representative to reach out to them and really put it on their radar that this is people's lives that we're talking about. This is not some cartoon character that doesn't exist. This is your neighbor. This is the person that lives across the street from you. This is your best friend. So thank you so much for allowing me the opportunity to speak and get this message out that really these are the conversations that healthcare professionals are having with one another constantly in the hospital. Doctors and nurses, nurses and anesthesiologists and patient care techs, we are all having the same conversation. We're all scared. So I really thank you for the platform to have this conversation and get that message out.
Thank you. Thank you, Heather. And as I was saying, we just got back from D.C., so I wanted to make sure that we took the time tonight and to bring everyone fully up to speed. And I think the essence of Heather's message is this impacts people's lives. This is about the people you know, your family, your friends, your neighbors, etc. And a couple of things. I think especially because these things, people should know why this is happening, what we're fighting for, and what's at stake here. And a couple of things have come up. I want people to know that, I want to be clear that as long as we're in this shutdown, and during this shutdown, I will not be taking my salary as a member of Congress. But I'm also proposing that, along with members of Congress, that the President of the United States and all the cabinet and presidential appointees forego their salaries as well. It occurs to me that a lot of people, and especially if you're a billionaire and you don't have those kitchen table discussions about how you're going to make ends meet and what you're going to do about the rent or the mortgage or heating and cooling your home or paying for your kids' education or just simply putting gas in the car, then you don't have a sense of what people are going through and the fear and the concern and the anxiety that we're putting them through. And so members of Congress and certainly the President and the administration should understand that impact. Our troops, our federal workers who keep this country running, they should be paid. And we fully expect them to receive back pay. They are guaranteed, because that's vitally important as well. I want you to also know from a very practical standpoint that my office has prepared a web page with answers to common questions that you may have that you can visit at larson.house.gov. For now, Medicare, Social Security, and Veterans benefits will continue, but staff at all of these agencies have been furloughed, reducing the number of staff available to meet requests. And alarmingly, our office has been told these agencies are discontinuing congressional inquiries. Now, that's not right. And I can assure you that we are here to serve you during this time. Our office continues to send and communicate inquiries on your behalf, and we will continue to receive your mail. Passports will still be processed. SNAP benefits will continue. Airports are operating as usual, but 16 days into a shutdown, we are starting to see delays at airports across this country. And talking with the workforces out there, as I have for the last couple of weeks, I know the concern that they share as well, and it's unwarranted. They shouldn't have to be going through this. Please take these into consideration as you plan travel during the shutdown. Many federal workers have been furloughed but will receive back pay when government reopens. Just yesterday, a judge blocked the illegal firing attempt by the Trump administration, and we're going to encourage our justice system to do the same and stay on top of this situation. The president has tried to eliminate the entire Office of Special Education, as well as staff who oversee mental health and addiction services and disease prevention efforts at the CDC. Trump has also tried to say some federal workers won't receive back pay, but he had just signed legislation into law himself guaranteeing that back pay. We won't let him ignore the law. Republicans, unfortunately, are nowhere to be found. And under the Republican budget Trump signed into law, 15 million Americans will lose their health care, both Medicaid coverage and the Affordable Care Act plans, including 167,000 people in Connecticut. That's simply flat out wrong and unacceptable. And that's what this is all about. The budget was passed directly along party lines with no Democrat voting for that because of what it did to everyday working people. These tax credits expire. 19,000 residents in our district alone will see skyrocketing costs. The average family of four will see their costs rise by $2,571 next year. Believe it or not, there is a 60-year-old couple in our district who will see a $25,000 increase due to both their income and their age. As all you know, that's how insurance works. We will continue to stand up for federal workers and ensure they receive their pay, and we're going to continue to fight for our military as well. And you can continue to reach my office for assistance, and we will always be there to help you. And I can't emphasize this enough. Please call us at 860-278-8888 if you have any questions whatsoever. There's too much at stake here. I thank Heather again for laying that out in a very pragmatic and direct way in terms of this impact on our healthcare system in general. And now I'm going to open it up for questions that you might have for either myself or Heather, and we'll do the best to answer them to the best of our ability. And if there needs to be follow-up, we'll follow up with those as well. And if we don't get to your question in the time allotted, please give us the information and we will answer all questions from everyone that has one. So with that, let me throw it back and open this up to questions, Charles.
Thank you, Congressman. And as a reminder for everyone on the line, if you have a question, you can press *3 now. We will begin taking questions from the audience. And I will start with a question that was submitted online, coming from Angela, who's joining us from Bristol. And she asks, I'm disabled, and although I live in low-income housing, I still find it hard to make ends meet. How can you protect my health care?
Well, Angela, thank you for, first and foremost, for sharing your story. I assure you're not alone in terms of what people are thinking about and concerned. We're working every day with healthcare advocates like Heather who understand the impact these cuts will have. The Republicans cut Medicaid and are letting the Affordable Care Act tax credits expire. The results of this are catastrophic, as I think Heather laid out rather cogently. Letting healthcare premiums spike for over 100,000 people in Connecticut, including 19 residents in Connecticut's first CD, is just flat out unsatisfactory, and that's what we're fighting to restore. The Trump Republican budget kicks 15 million Americans off of their health insurance. And for what purpose? To pay for tax breaks for billionaires? My God, even billionaires are embarrassed by what they're doing between taking 15 million Americans off of their health insurance and taking food out of the mouths of children and the elderly and the disabled through the SNAP program. Just, number one, it's immoral. It's not decent. It's not the right thing to do. It's not the America that all of us know and grew up in and respect. That's why we're standing up strong, and we're not going to vote for funding a bill that rubber stamps these cuts and does nothing to help the American people during this time. Still, having gone through COVID and then going through this global inflationary period that people are struggling with. Now is the time for people to come together. Together we're ready to fight for these things because we know they're needed and we know that they're essential for our economic growth to continue as well. That's what we're fighting for. And Angela, thank you for the question.
Okay. Our next question comes from a caller who is joining us live tonight, and he has a question about Social Security for the Congressman. And Claudio from Wethersfield, you are live with the Congressman.
Hello? Do you hear me?
Claudio?
Yes.
Hi,
Is this
Claudio.
Congressman Larson? How you doing,
Yes.
Congressman Larson?
I'm doing great.
Okay. So my question is that, you introduced Social Security 2100 back in 2014, and then
Right.
you came over to Wethersfield and you talked, and I got up at that talk in 2018, that I said that I didn't see how you could get that, vote through. And you said, yeah, I'll get the vote through. And then I went to the Glastonbury when you were with Courtney, and I said, man, your own party doesn't want to do this. And here we are, and it's 2025. We're 11 years later, and I just have a hard time believing that, I think the political system is broken, basically. That's why our healthcare system's broken, because very well that when Obama was president, we needed a public option that went along with that affordable care. And the reason why the public option didn't get put in is because Lieberman said he would filibuster against it. So, because the insurance companies have such power in Connecticut, and the whole money situation in the country really runs like what happens. So here we are, now in 2025, and we're fighting for something that really should have been put in place years ago, And so my question is, what do you believe now about your Social Security 2100, because the other night I had a dream, and I asked God, when do you think 2100 will come to pass? And he said to me, not in my lifetime. So,
you asked God that?
Yeah, I did, because
listen.
Because
first of all,
it's been 11 years.
Thank you for joining us on the call this evening, and thank you for your question. It took Ted Kennedy over 24 years to finally get health care enacted. In a democracy, and with the margins so close, it's very difficult. And as you pointed out, even sometimes within your own party, especially after we had just passed the Affordable Care Act, and after we did the first time, you may recall what happened, Democrats were thrown out of office. And there was a lot of deep and abiding concern when we came back, as it was tried to be repealed over the next several years. We restored the Affordable Care Act. I felt there should have been a vote on Social Security, and there wasn't, even though we had over 212 signatures on there. But there were some who didn't believe that that was the case. I remain both optimistic and positive. Every Republican that I talk to says, hey, if your bill is on the floor, I'll vote for it. I said, well, help me get it to the floor. So you can't give up in a democracy ever, and especially when you have something as huge as Social Security that impacts over 300 million people. But also, the other side, the Republicans say, yeah, that's taxes on 300 million people. And they play it in the wrong way, from my humble opinion, because what this is actually the safety net for capitalism. And that's why I feel strongly that this is going to pass, because the more you get out and talk about it and educate the public, and they see the common sense value of it, especially during a time of inflation. Imagine Social Security hasn't been adjusted across the board since 1971. Richard Nixon was president of the United States. There's been an awful lot of people that have said they want to try to fix it, but no one's come up with a specific proposal. We have. It's comprehensive in nature, supported by over 350 organizations, including the National Committee to Preserve and Protect Social Security, Social Security Works, the AFL-CIO, the NEA. I could go down the list. But going down the list, to your point, doesn't matter unless you're able to bring it forward. I'm proud that for the first time we have Hakeem Jeffries, who will be the next Speaker of the House, who has endorsed the bill and has agreed, and within the first 100 days that we are back in control of the Congress, will be passing Social Security 2100. It'll probably be under another name, but it will contain the same benefit enhancements, including across-the-board increases for everyone. No more taxes on your Social Security. Making sure that teachers and municipal employees and others are not hurt by Social Security. Uplifting Social Security so that no one can work and pay into Social Security all their lives and get a below poverty level check. That's been my mission and focus in Congress. That's what it will continue to be. You can never give up. No matter how discouraged you get, no matter how difficult the times are, you have to lean into it and get the job done. That's what my focus is. That's what it will continue to be. I thank you for your question. I appreciate your frustration. Believe me, I get frustrated too, but you can't give up and you can't quit, because you know it's the right thing to do, and you know that it's beneficial overall to every single American. It is the backbone of our society. It's what keeps capitalism and entrepreneurialism and free markets open, that we have a safety net that can help people out. And people haven't seen an enhancement in more than 50 years. That is going to change. And trust me on this, Hakeem Jeffries is going to make it happen.
Thank you, Congressman. Our next question is an online submission from Christine in Berlin, who says, I'm trying to plan a vacation and noticed I needed to obtain a new passport since mine expired. Will these offices be open to assist people during the shutdown?
Well, thank you, Christine. Again, these are some of the very practical questions that get asked, and important questions as well. But consular services, passport services, visa services are continuing during the government shutdown. The passport agency is designated as an essential service provider and is funded through passport fees. So all of passport services should remain open during a federal government shutdown. Current passport processing time is between 4 to 6 weeks, so please make sure to leave enough time between applying and your travel dates. If the shutdown is prolonged, passport and visa issuance could be delayed further. But again, for those continuing to travel and visit our airports, please monitor for any potential travel delays. TSA and air traffic controllers are working, but some airports have seen some delays and had to reduce the number of daily flights already. So we're hoping for a quick return and reopening of the government and getting this done. But again, as with anything else, if you have a problem, please call our office directly, and we'll make sure that we assist you as well.
Our next question comes from a caller asking about Medicaid. And Jean, you are live with the congressman.
Okay, so my question was about the cuts that they want to make to Medicaid and some to Medicare. And so because those cuts directly affect the disabled and senior citizens, has anybody just asked the Republicans, come out and ask them, do they just want, is their motive to make, they are looking to have people die so they don't have to pay Social Security, so they don't have to pay these expenses? Are they really, by doing that, are they really saving money, taxpayer money? Is that what their motive is? You said that the what's happening is to make the wealthy wealthier. Well, we already know that, but has anybody just come out and asked, do they want, the senior citizens and the disabled to pass away so that they don't have to worry about these payments? Has anybody just come out and asked them that?
Yes, and unfortunately, the sad thing is that there needs to be a vote. That's what we're elected to do, number one. And the crazy thing is that Republicans aren't saving any tax dollars by this. And to your point, and when you listen to Heather speak, and again, this isn't coming from an elected official, this is a healthcare provider saying that people will die, to your point. So has the question been put to the Republicans? Absolutely. And in a straightforward manner, as you said, that noting that the ranking member of the Ways and Means Committee, Rich Neal, said, that people are going to die from this if we don't take action. How can you sit here and not respond to this? This budget bill, in fact, is, and that's the other nonsense about it. This budget bill that they passed, the so-called great people concerned about the national debt, will add $4 trillion to the national debt. That's according to the nonpartisan Congressional Budget Office. They're cutting nearly $1 trillion to Medicaid and over $100 billion in food assistance. And why? Because, as you know, so that the wealthy can get a tax cut. The average top 10% of earners will get a enormous tax cut. It's just not right. And I think Americans know this, and I think that's why so many have encouraged us to stay the fight, and there should be an open debate. Nobody needs to go behind closed doors. Have an open debate watched on C-SPAN, on the floor of the House and on the floor of the Senate, and let people get up and speak their minds. And Gene, as you pointed out, and answer the question directly. You know what the statistics are. You know what the facts are. Are we going to let people perish when we know what the right thing to do is here? I've said this before. I think even billionaires are embarrassed by where the money is coming from to pay for these tax cuts. So thank you, Gene, for your question, and greatly appreciate it. And it should be asked in public, and more importantly, there needs to be a vote.
Our next caller is Sheila, who's joining us from Hartford, and she has a question about nutrition benefits for women, infants, and children. Sheila, you are now live with the Congressman.
Thank you. My name is Shayla, and I work for women, infants, and children in New Britain. And I'm concerned about the government shutdown and the continued funding during the shutdown, since we're only covered for, 30 days right now. I'm very concerned about families and what this will do to them if they don't get their benefits.
Well, we certainly share your concern, and I'm going to ask Heather as well if she wants to jump in on this. But you're spot on with your point. And to date, right, these essential benefits are being paid for. But at the end of the month, a whole other set of questions are going to arise based on a lot of the information you heard Heather provide, as well as what's going to happen in the economy and what's going to happen within the agencies where people have already been furloughed, where they're already operating under stress, where they're being asked to continue to operate without pay in many instances. It just simply is wrong-headed and not right. And Trump believes that he can turn this into a political game and win by saying, I can get the Democrats to back away, ensure that the wealthy get their tax cut, and blame some of my faulty policies on the Democrats and why these things are the way they are. Never talking about tariffs and what a bad thing that has been for the nation and what that's done for the cost of living. Don't take it from me. Take it from the Wall Street Journal and the New York Times and the economists who have talked about this. And I think the American people are far wiser than the president wants to give them credit for. And not everybody is taken in by his political theater. Heather, did you want to answer that at all?
We as healthcare workers, we have a lot of patients that come into the hospital here that were utilizing Planned Parenthood also. So they were utilizing Planned Parenthood for obstetrics and gynecologic care leading up to the delivery of their children. And then after their children are delivered, they're using services like WIC and SNAP. And they're not hard to come by. 430,000 people in Connecticut, just about 10%, it looks like, about of the state's population relies on the SNAP program, and about 53,000 residents rely on WIC. So cutting these benefits, luckily there was a small infusion of money recently, right, that I think will hopefully get them through the end of this month. Correct me if I'm wrong, Congressman Larson, but obviously, they need to come back to the table and talk about these real issues this is not a joke to the people that live in Connecticut and rely on these programs and services. This could literally be the difference between life and death for people. And it's not something to be taken lightly. So taking their ball and going home and not returning for over 2 weeks to even debate and discuss the issue is just wildly petulant.
Thank you. Our next question comes from Anne Marie, who joins us online in Glastonbury, and she asks, will healthcare premiums for plans purchased through Access Health Connecticut definitely rise?
Well, again, Anne Marie, thank you for your question. Yes, premiums for the 2026 year will rise, and families will need to start paying in December. Open enrollment starts November 1st, and everyone will be able to go and see how they will be impacted. 19,000 residents currently receive advanced premium tax credits in the 1st Congressional District in Connecticut. If Republicans refuse to come to the table and sit down and negotiate with us and make sure that these are made available to people, the average family could see costs increase by $2,571 at a time, as we stated earlier, in this inflationary period that we're in, when nobody can afford these kinds of increases. Even families who do not receive these tax credits will see an increase. Why? Premium rates for all plans on the exchange are rising, in no small part due to the fact that fewer healthy people will be able to afford insurance, and that's going to drive up costs for everyone. Even if you're not on the exchange, when thousands of people lose their health insurance, they're going to go, and you heard Heather explain this earlier, they're going to go to the ER, and that's going to raise healthcare costs overall and start raising everyone's premiums as well. The American people can't afford this Republican healthcare crisis. That's why we're fighting, tooth and nail to lower your costs now and to take this fight and make sure that while we're in this budget discussion with the president, essential to keep government open and running, it doesn't get open and stay running at the expense of people to advantage billionaires who frankly don't need the cut for people that instead need it for their very existence in health care. I don't know if Heather wanted to add anything to that either.
I know, just looking through a handful of articles that I used to prepare heading down to DC to just kind of get the stats in my head, and it's hard to wrap your mind around the kind of numbers that they're talking about. But the Connecticut Mirror did an article last week that, on average, it's going to be about 17% is what they're expecting. And the three major insurance plans through that Access Health Connecticut is Anthem, Connecticut, and then CT Care Benefits. So anyone who's insured under those plans should be expecting to see about just under a 20% increase. And people who can't afford what they're spending right now and what's coming out of their checks and is living paycheck to paycheck. We have nurses here that work at the hospital who are working full-time, who are working paycheck to paycheck. It's everywhere. It runs the gamut of constituents within this state. But anyone who has insurance coverage should really be going and doing some research on what their insurance company has requested the state to allow them to increase their premiums by, because it varies by insurer to insurer. But those three plans, on average, they're looking at about a 17% increase, and that's just not sustainable for some of our Connecticut families who are using Access Health. It's just not feasible.
Thank you, Heather. Our next question comes from Nia, who is 11 years old and joining us in Hartford. Nia, you are now live with the Congressman.
Hello.
Hi, Nia.
Hi.
Glad you could join us tonight.
Yep.
What can I answer for you?
So I would say that I wanted the I want the Senate to not vote with the Republicans because I have asthma real bad and I need my insurance.
Well, Nina, let me assure you that I'll be voting for you, and because first and foremost, we want you to be able to breathe and to be able to continue to have a normal life by being able to get the care you need for your asthma. And I know at 11 years old that's got to be tough. But in order for you to be on the phone tonight, that shows you have a lot of courage as well, and shows that you're willing to speak up and be heard and speak out. And that's what all of America has to do. And so I thank you for calling in. I assure you that we're going to continue to not only fight for you, but for all children, but for all Americans as well, to make sure that they have the kind of health care that they're going to need to get through these very difficult times. But thank you so much for calling in. Greatly appreciate it.
Thank you, Congressman. Our next question is an online submission from Natalie in West Hartford, and she says, what can Congress do, if anything, to stop Trump's firing of federal employees and canceling federal funds designated for quote-unquote democratic projects during this shutdown?
Well, thank you again, Natalie, for that question. And frankly, even though, and I think everybody on the line knows it's very clear that the Republicans control the presidency, the executive branch, the House of Representatives in Congress, and the United States Senate. But they are co-equal and separate branches of government, along with the Supreme Court, make up our three branches of government. But they're separate and equal branches of government. And Congress needs to reassert their authority, period. What this president is doing, and everything from the militarization of our National Guard and only sending them to cities and states that are controlled by Democratic governors or Democratic mayors, preposterous. For him to say, and along with the Secretary of Defense, bring our generals from abroad home to Virginia and say, listen, we want you here at home because we're going to be calling you back. We no longer need you around the world. We have to have you back here at home to fight the enemies from within. It is astounding that a president of the United States would say something like that, and implying that he will use the military to deal with his political enemies. It's vitally important, no matter what party you're in, that you stand up for the Constitution and understand the importance of carrying out your responsibility. We are not going to let the president ignore the law and enact political retribution. I've joined colleagues in the House and Senate to demand the Trump administration follow the law and give our public servants the pay that they are due. And I want to be clear, members of Congress shouldn't be paid during this shutdown. I'm not going to take my salary, and neither should the president or all of his cabinet members and political employees. The president is also refusing to dispense lawfully appropriated funding. Just recently, the entire Connecticut delegation came together to call out a $52.9 million in cuts to the clean energy projects in Connecticut. Again, retribution on the part of the president, grossly overusing his power and authority. This directly interferes with efforts that have been going on for years to lower energy costs and grinds progress combating climate change to a halt and stalls the change that we need here in this country and around the globe. Congress has the power of the purse, not the president, and we cannot continue to let him trample on the Constitution. Our constituents depend on us to stand up for them and fight for federal funding that supports our communities. I assure you, I will continue to do that and continue to oppose this president. Even if he puts me on his top 10 list, I am not afraid of the president or his retribution and will continue to stand up and fight for the people of the 1st Congressional District, the state of Connecticut, and every American across this great nation of ours.
Our next question comes from Corinne, who is a live caller who has a question about ICE. Corinne, you are live with the Congressman.
Hello, Congressman. My name is Corinne. I live in Rocky Hill. I actually have a lot of worries right now. I work for Connecticut Birth to 3, so I'm worried about children and families who have disabilities. But my being concerned that the reason I'm asked a question was about ICE in Connecticut. I know yesterday there was an arrest in Hamden. I've been watching things happening in Chicago, masked men not identifying themselves, even arresting U.S. citizens, provoking protesters. In D.C., there's multiple law enforcement agencies wasting taxpayer dollars to patrol, which should be a local issue. Mike Johnson characterizes planned peaceful protests as hate America rallies and setting up those who are protesting as Antifa, which the president has deemed domestic terrorism. I'm just asking, as a concerned person, what's the Democratic Party planning to push back against this to protect citizens and non-citizens alike? And, how do we even know these men are federal agents if they refuse to identify themselves?
Well, you're singing our song, but I don't know if you perhaps caught Chris Murphy on the floor of the Senate last week, but I thought he did a great job of outlining what Democrats are fighting for and what we're standing up against. And because things are happening so fast and furious, sometimes the public doesn't see, but there is a theme to all of this and everything that Trump has been doing. And as Senator Murphy pointed out, from the indictment of Comey to the cancellation of Kimmel, the troops in Chicago as different events, they are all part of the same story. They are all part of a plan. And actually, a very well thought out plan that at its core has, I think, what David Burns, the great author and political columnist, has said. He's referred to Trump as a narcissistic nihilist, someone whose ego is absolutely consumed with himself and consumed with engaging and taking as much power as he possibly can. The Constitution is not, for him, the rule of law. It's a suggestion that he may or may not follow. But if you connect the dots, as Murphy says, you'll see for yourself the whole story, the totality of the story, as you see the grave danger that we're in and the need for citizens to speak up and members of Congress. Not only Senator Murphy and myself, but all members. This delegation all stands together in Connecticut, both our senators and all 5 members of the House. And Murphy said it best, the authoritarian takeover isn't coming, it's here. We're in the middle of it. But it's not too late for everybody to see it and for us to stop it by standing up and fighting. When you witness what we did just in this district, in Newington and Southington, with men with masks, armed with guns, coming and taking mothers from their children with no warning, no coordination to state officials, no warning to the locally elected officials, etc. The mayor of Newington said, "Oh my God," he says, "I've never seen such fear in our community." He says, not only the immigrant community, but the very citizens of Newington. He said, "My wife is an immigrant, and she's afraid," the mayor of the city's wife, afraid of the actions this megalomaniac is taken by having these men in masks, armed with guns, coming and taking people away. That's not the America we all know and love and respect. That's why you have to stand up and fight against Donald Trump and the abuses of government that he's taking the liberty and calling and trying to pretend that he's doing the right thing here. Due process, the Constitution, the rule of law is what this country is founded on, not on authoritarian, dictatorial moves that have people with black masks and guns stripping people, taking mothers from their children. I feel very strongly about this, as you might gather, and we are going to continue to fight, but thank you for your questions. And let us hope that our Republican colleagues who understand this as well stand with us and engage in this fight to stand up against this authoritarian rule. We are a nation of laws. We, the people, in order to form a more perfect union, bond together, and we adhere and take an oath to the Constitution, not to an authoritarian figure like Donald Trump.
Thank you, Congressman. And now we are coming to the end of our live event this evening. Thank you for taking the time to join us for this important Access Live event with Congressman John Larson. If we were not able to get to your question this evening, you can leave a voicemail after the event by calling 860-278-8888. Now I will turn it over to Congressman John Larson to close us out. Thank you again.
Well, thank you, Charles. But most importantly, I want to thank everyone who tuned in this evening. I know you wouldn't be on the line if you didn't care deeply about your nation, your community, and your state, and the people that you love and respect. We're all in this together. And I especially want to thank Heather for joining us this evening and taking her valuable time to help further educate you to what needs to be done. And I think together, the nation always goes through difficult times, and clearly, and I say this to people all the time, we've been through worse times than this. But we get through these times by standing together, and standing together, understanding in the Constitution state, the state that came up with the fundamental orders, the state that's called the Constitution state because we know we are a government of laws. and a government of and by and for the people. We are not an authoritarian government. We are a government of the people, and the people must speak out and be heard, and they will, and this government will sustain itself. Thank you for tuning in tonight. Thank you for your questions. Thank you for your care and concern about the nation we all love. God bless you. God bless America.